Dr. Cat, epidemiologist. Let's talk about Pfizer, the Delta variant, and Israel, because by this point, I'm sure you all heard that the Israeli health minister was in the media saying there was a decrease in the vaccine effectiveness against infection in their population. Putting this in the proper context, there are enormous methodological challenges in collecting data on infections and comparing that data across populations. There's a lot less variability in the real-world data with respect to endpoints like severe disease, hospitalization, and death, because those are based on things other than just testing. So the Pfizer vaccine in the UK from the Public Health England report was 96% effective at preventing hospitalization. In the Israeli data, it's 93% effective at preventing hospitalization. Much less variability because that endpoint is very finite, whether the person went to the hospital or not. So with mild symptomatic disease or infection, it's really hard to gauge vaccine efficacy when testing is done selectively. So because of the methodological challenges and biases that exist in collecting data on infections in real-world data, we aren't surprised to see some variability in the outcome. 64% in Israel versus 88% in the data that was collected in the UK. So we can probably make an assumption that the truth is somewhere between those two numbers. From a herd immunity perspective, we know that we have a variant that is more transmissible. Public Health England determined it to be 60% more transmissible. We also have a vaccine that's less protective against this variant to differing degrees depending on where the study was done, 88 versus 64%, but different nonetheless than a clinical trial data with the original virus. So same message. Let's get as many people vaccinated as possible. These are mild cases that they're finding in Israel for the most part. We need to protect our children who are not vaccinated yet, protect our immunocompromised adults and people that aren't yet fully vaccinated.